Welcome back. The pandemic is changing the way our friends and neighbors get sober. Trends are also showing people misusing substances, and many may not be seeking help.
As Jim Spiewak reports tonight in tonight's Addicted Utah, officials have some big concerns over the pandemic's effect on use and treatment.
Yeah, and that's really forcing these addiction specialists to keep a very close eye on some of these emerging trends that they're seeing. And they tell me they would not be surprised if they saw an onslaught of those finally seeking treatment once things start to slow down from this pandemic. Under the water is a place Curtis Young cannot be tempted by alcohol.
When you wake up, the first thing that's on your mind is that bottle.
Curtis loves diving, but his struggles with alcohol for most of his life has delayed his goal of being a master diver. He entered rehab back in February at the start of the pandemic.
Things have to change because of, safety as far as the virus goes.
At Odyssey House, where Curtis was getting treatment, people had to separate into small groups, and he met his therapist over Zoom, missing out on a lot of social connection.
That's the most dangerous part about this pandemic is, literally the opposite of addiction is connection.
Dr. Paula Cook, the chief medical officer at Odyssey, says isolation drives addiction, which makes this time period so risky.
We may be feeding another public health crisis that we continue to need to grow awareness around.
Another warning sign, overall admissions at Odyssey House are down.
It makes me really worried because I know people are still struggling with addiction and they probably need treatment just like they did. In fact, maybe even more so. They're just not accessing it.
But at the same time, Odyssey reports they've seen nearly a 78% hike in people seeking treatment for alcohol misuse compared to the same time period last year.
Alcohol's widely available, it's accessible, it's socially acceptable. And so with that comes overusing, especially in this stressful, isolating time.
And it's not just alcohol. David Watkins, a prevention director with the Division of Substance Abuse and Mental Health, is seeing a concerning trend with opioids here in Utah.
So some of the data that we have is the increase in non-fatal overdoses, those that are presenting to emergency departments, that has increased since the 1st of April.
Preliminary reports from the medical examiner's office show overdose deaths may increase as well.
Or the fatal overdoses haven't increased as much, but they are starting to trend in that way, and so we're going to keep our eye on it and see where it goes.
Watkins says connection is key in curbing these trends, which is something treatment centers like Odyssey are still trying to offer, even if it is just online.
And it may not quite be the same as meeting in person, but I think there's still a community to be gathered by being online, and you can still get good therapy.
Like Curtis has experienced, even though he still has not met his therapist face to face.
I am lucky enough now that I have a second chance at life.
Now, the medical examiner's office is monitoring very closely both fatal and non-fatal overdose data, and there is a report that is expected to be put out a little later this fall that'll show a little bit better correlation of exactly what is going on with respect to that right now during this pandemic. So that's something we are going to keep a very close eye on. Now, if you have any need to reach out, we have a ton of resources over on our website, KUTV.com. Just click on the Addicted Utah tab, and it was there that you will find a lot of resources for anyone that might be struggling with substance abuse right now. We're live downtown tonight. Jim Spiewak, 2 News.